This is Chapter 23, Module 2, Pulmonary Ventilation. The learning objectives of this module are 1. Summarize the physical principles governing the movement of air into and out of the lungs. 2. Describe the origins and actions of the muscles responsible for respiratory movements. And 3. Define respiratory air volumes and capacities. Respiration refers to two integrated processes, external respiration and internal respiration. External respiration includes all processes involved in exchanging oxygen and carbon dioxide with the environment. Internal respiration involves the uptake of oxygen and the production of carbon dioxide within the individual cells. Internal respiration is the result of cellular respiration, a biochemical process we will discuss in a later chapter. With external respiration, there are three processes: pulmonary ventilation, or breathing, gas diffusion across the alveolar and capillary membranes, and the transport of oxygen and carbon dioxide between the alveolar capillaries and between the capillary beds and other tissues. The first process, pulmonary ventilation, is the physical movement of air into and out of the respiratory tract. The second process, gas diffusion, takes place as oxygen diffuses into the blood from the alveoli, and at the tissues as oxygen diffuses out of the blood and into the interstitial space. Gas diffusion also takes place as carbon dioxide diffuses out of the blood and into the alveoli of the lungs, and as carbon dioxide diffuses out of the tissues and into the blood to be delivered to the lungs. The third process is the transport of oxygen and carbon dioxide in the plasma and red blood cells throughout the blood vessels of the body. We will discuss the second and third processes in a separate module, but we'll discuss the first process, pulmonary ventilation, in this module. The first process, pulmonary ventilation, is the physical movement of air in and out of the respiratory tract. This provides for alveolar ventilation as air is moving in and out of the alveoli. The movement of air is dependent on pressures in the atmosphere and pressures within the thoracic cavity. The movement of air can be explained in gas laws, such as Boyle's law, that describes the relationship between gas pressures and volumes of gas. There's a relationship between gas pressure and volume of gas that can be measured in Boyle's law. Boyle's law states that there is an inverse relationship between pressure and volume. This means that if the volume is halved, the pressure is doubled. The reason for this effect is that a gas is made up of loosely spaced molecules moving at random. If a gas is compressed in a container, these molecules are pushed together, thus the gas occupies less volume. The molecules, having less space in which to move, hit the walls of the container more frequently and thus exert an increased pressure. Conversely, if the volume in a container is increased, fewer collisions occur because it takes longer for gas molecules to travel from one wall to another. As a result, the gas pressure inside the container declines. Air will flow from an area of higher pressure to an area of lower pressure. The movement of air from high pressure to low pressure causes inspiration, or inhalation, and expiration, or exhalation. When the volume of the thoracic cavity changes by contraction or relaxation of the diaphragm and elevating or depressing the rib cage, inspiration or exhalation will occur. For example, when the diaphragm contracts, it depresses, increasing the volume of the thoracic cavity. As the volume increases in the thoracic cavity, the pressure decreases. And as the pressure in the thoracic cavity decreases below the pressure in the atmosphere, air will move in from the atmosphere and into the lungs. Look at it this way. The pressure in the atmosphere is a constant pressure from moment to moment for the most part. When no inspiration or expiration is taking place, the pressure in the atmosphere is the same as the pressure in the thoracic cavity. But the pressure inside the thoracic cavity changes when certain muscles contract, causing the thoracic cavity to get larger, thus increasing the volume inside the thoracic cavity. When the volume in the thoracic cavity increases, the pressure decreases. Now the pressure inside the thoracic cavity is lower than the pressure in the atmosphere. Gases move from high to low pressure, so gas will move from the atmosphere into the lungs. This is called inspiration. When the muscles relax and the volume of the thoracic cavity decreases, pressures rise, and air moves out of the lungs and into the atmosphere again. Muscles used in inhalation include the diaphragm, which provides 75% of normal air movement, and the external intercostal muscles that assist inhalation by providing 25% of normal air movement. Accessory muscles such as the SCM, serratus anterior, and the pectoralis minor all assist in elevating the ribs during more active breathing during exertion. During normal breathing, the diaphragm and external intercostal muscles relax to provide exhalation. So normally, exhalation is a passive process that doesn't require muscle contraction or ATP use. During more active exhalation, muscles such as the internal intercostal and transversus thoracis muscles depress the ribs, and the abdominal muscles compress the abdomen, forcing the diaphragm upward. Respiratory movements are classified as either quiet breathing or forced breathing, depending on which muscles are active. Quiet breathing, or eupnea, involves active inhalation and passive exhalation. Quiet and deep breathing primarily occurs due to the activity of the diaphragm. Quiet and shallow breathing is dominated by the movements of the rib cage. Forced breathing involves active inhalation and exhalation. It is assisted by the accessory muscles. The respiratory system adapts to changing oxygen demands by varying the number of breaths per minute, called the respiratory rate, and the volume of air moved per breath, called the tidal volume. The total lung volume is divided into a series of volumes and capacities that are useful in diagnosing problems. There are 4 pulmonary volumes: resting tidal volume, expiratory reserve volume, residual volume, and inspiratory reserve volume. The resting tidal volume is the tidal volume in a normal respiratory cycle, or in other words, is the volume of air moved per breath in a normal respiratory cycle. The expiratory reserve volume is the amount of air that can be expired after a normal exhalation. The residual volume is the volume of air remaining in the lung after maximal exhalation, and the inspiratory reserve volume is the amount of air that can be inspired after a normal inspiration. From these volumes, respiratory capacities can be calculated: inspiratory capacity, functional residual capacity, and vital capacity. The inspiratory capacity is a calculation to determine the tidal volume, air moved per normal breath, plus the inspiratory reserve volume, or air inspired after a normal inspiration. The functional residual capacity is the calculation of the expiratory reserve volume, air expired after a normal exhalation, plus the residual volume, air remaining in the lung after maximal exhalation. The vital capacity is the calculation of the expiratory reserve plus the tidal volume plus the inspiratory reserve volumes. The total lung capacity is the calculation of the vital capacity plus the residual volume. This ends Chapter 23, Module 2, Respiration.